Well, welcome to the Daily Brief on Metro Milwaukee's health and the economy. My name is Tim Sheehy. I'm president of the MMAC, and joining me is Dr. John Raymond, president of the Medical College. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC. And today, our special guest is Keith Corson, president of Desert Air. And Keith also serves as chair of the Council of Small Business Executives and chair of the Council of Growing Businesses. So he brings a good feel for the impact of this crisis on small, mid-sized employers. But let's start with our update today from Dr. Raymond.
Thanks, Tim, and good afternoon, everyone. Let's go ahead and go straight to the scorecard. Today, there were 43 new COVID-19 positive tests in Milwaukee and 121 in Wisconsin. And the average daily growth rates, calculated using all of the data since March 12th, continue to improve to 5.6% in Milwaukee and 6.3% in Wisconsin. We've included a new metric which measures the average daily growth rate over the last 7 days, which could give additional insights into our current state. And the 7-day average daily growth rate was 3.2% in Milwaukee and 3.8% in Wisconsin. Now recall a month ago, the growth rates were nearly 35%. So this demonstrates continuous progress in slowing the spread of COVID-19. Now on to the doubling time. The doubling time continues to improve to about 12.3 days in Milwaukee and 11 days in Wisconsin. So again, we continue to make great progress. Now later in the week, I'll show you some intriguing evidence that Milwaukee might be doing better than other parts of the state in terms of stemming the growth of COVID-19. And I think you can see some hints of what I'm going to discuss on this slide. If we go to the next slide, please. This slide shows key indicators of hospital capacity, and the capacities are similar to those that we showed last week. The first 3 rows show that we have ample capacity of hospital beds, ICU beds, and ventilators in our region. So we've avoided a surge that would overwhelm those capacities. But we still have a significant number of hospitals with an insufficient supply of personal protective equipment, as shown in the last row. Looking at trends, though, there does seem to be some improvement in this metric, but we need much more work for the supply chain of PPE to be secured. And in that regard, I'm encouraged by the focused efforts of our Wisconsin manufacturing sector to address this critical issue. Tim mentioned to me earlier that Quad and Husco, for example, have begun to produce PPE, as have many other Wisconsin companies. And for those efforts, I'm both encouraged and grateful. Thank you, Joel Quadracci and Austin Ramirez, and all your colleagues in the manufacturing sector for making PPE a top priority. And we couple those efforts with the work that Exact Sciences and Promega are doing to bring more COVID-19 testing capacity to Wisconsin, we can see that focused cross-sector collaborations really can work. Next slide, please. This slide shows our health and safety indicators. Next slide, please. 2 of them remain in yellow. Eric, thank you. 2 of the indicators remain in yellow, and these are the sustained case reductions and hospital capacity. If we could go back a slide. And these are denoted in the left-hand column as cases and care. We're in the red for 2 other indicators. And please note that in this report card, we're not showing the public health indicator because we now believe that better fits into the mitigation and containment plan. And we'll continue to develop a comprehensive smart restart framework and plan. So thank you everybody for your attention, and I'll send it back to Tim.
Right, Dr. Raymond, as we bring Keith in here to talk a little bit about the impact on small and mid-sized businesses, it looks like the U.S. Senate is poised to pass a $450 or $480 billion relief package. And one of the things that you've been talking about is funding for tests, both at a national and a state level. And it looks like there's about $25 billion in there for the testing part of this. So just want to get your reaction to that.
Yeah, we absolutely need more testing capacity, and that type of investment, I think, is focused on what matters in terms of the healthcare sector. And I know that there's also some money for health systems because many of the health systems are struggling because they created that surge capacity for COVID-19 and haven't been able to do their normal business. And I also noticed there's a refill for the PPP, which also I think is very promising and good news.
Yeah, and Keith, as we pivot to you, that's a good point to pivot on. You were mentioning kind of off air that you had applied for the previous PPP program. This one looks like it's going to get funded up to 310 billion. So tell me a little bit about that and how Desert Air made out.
Well, it took quite a bit of effort to get it all organized and agonized trying to get it through the banking systems that first weekend. We finally got ours accepted about 10 p.m. on a Sunday evening, and then later, about 5 days later, we were informed that we were able to secure our funding as it goes forward. I think it was an interesting process, frustrating at times, as everybody can imagine, especially for those that didn't get around to the first set of funding. Now we just have to get all the rules that are going to be clarified to figure out how we have to process this the right way, and we're expecting answers back from our banking partners here later this week.
Great, thank you. So Keith, maybe you should have started out with just describe for the audience what Desert Air makes.
Well, Desert Air actually produces Desert Air. We're a dehumidification manufacturer, and so we serve a wide range of markets, everything from the commonplace that everybody would know as an indoor pool to more complex ones, dehumidification of surgical centers, wastewater treatment plants, and other markets like the indoor grow ag marketplace that much of it has itself been considered as an essential business.
So talk a little bit about the impact of this COVID crisis on your company and your suppliers. How has this impacted your ability to do business?
Well, it has been an interesting process, and I guess I'll start off by saying there's absolutely no MBA program, no years of experience that could have possibly written an instruction manual how to handle this crisis, because it just seems like you finally get over one hump and another one comes into play. And so the first one was trying to get the business set up. When we realized that we're in a stay-at-home order, and we're going to stay in business, we had to take a look at what we're going to do. So we had already mapped out a plan to send 90% of our office staff home. We sent computers home with our engineers so they could run the power surged of the SolidWorks software that nobody would have on a home computer. We moved to a 4-day work week so that we could have 3 days that should a virus be brought in, it was deemed that 3 days would be enough time to kill it before we move back in. We tapped employees, we tapped friends, any seamstress we could find to go make coverings for all of our employees as we brought them back in. And now they're just like safety glasses. They are an essential item. You need to be wearing them when you're active in the plant. All the little things, no more free coffee, keep all the doors open, and we're going to add thermometer testing as soon as the thermometers that are on back order, many of them I think coming from China, will show up on our door. We've ordered those 3 weeks ago, and so you talk about a supply chain backlog, there it is. But I think one of the biggest things that we had to do is waive our attendance policy. And this is something that we've had in effect for many years. But we figured out we had to allow our employees to stay at home with their families should they have to. We allow the employees to stay at home if they're uncomfortable coming to work because of the virus. And we wanted them to stay home if they were ill. And so by waiving the attendance policy, we allowed them to know that they'll have a job when this all opens up, and they won't lose it because of a violation of attendance policy. And it has been successful with our employees understanding that and going forward. We did have a employee come down with the COVID virus, and so we even had to shut down for a duration. And how are you doing business when you're shutting down? And as you mentioned, the supply chain, it's like every day we hear another group of suppliers that are experiencing the same problem, or a supplier of a supplier. This morning was no different, but now it's the country of Mexico shutting down major suppliers to the HVAC industry that have had some manufacturing plants down there that feed other manufacturing plants in the US. It can get very interesting here in the upcoming weeks if the State Department can't help open that back up and move forward. So it has been an interesting time period. And I say anybody that hasn't experienced it yet, you better be flexible, and you better have an open line of communication with all your employees, because the new normal is here, and we really don't understand what's coming up tomorrow.
Yeah, and I think your example there is a great one to share with our policymakers and elected officials to show how appropriately aggressive you've been to protect your employees and your customers and the families of your employees. And again, as we're going to live in this new normal for quite some period of time, I think we're going to need to rely on leadership like yours to show what can be done in the private sector to take this on and deal with it successfully. What are you hearing from your peers as you lead the Cosby Group and you lead the Council of Growing Businesses? What are you hearing from your peers?
Oh, there's a lot of nervousness. I mean, one of the first things that just seems to come up is, the concern, will their market return when we get a chance to open back up? And more importantly, will they have the cash flow to survive? And I think that's a crucial question. The loan program will do a lot to help calm that, but that's assuming you were able to get qualified. I think your news earlier will be very helpful. And the other one is, when they're allowed to go back in, what's going to be there for them to go forward, and will I have any employees left? This is one I've been able to keep all my employees and demonstrate to them that we're committed to them. What happens if you're not one of those guys that did it? Where are your employees going to be when you want to turn around and open back up? I think it's going to be a significant question. And the other one stems more on the medical side, and this is where the information that Dr. Raymond has been providing us. But I hear, what do I do if I have a COVID patient? When can I allow that patient to come back to provide safety for my employees? When will my employees be able to get a test to confirm that we're all okay? Even just the simple question of, what is a health screen? How do I, as a manufacturing executive, know what to define a health screen? So I think we need a lot of assistance from the medical side and the government to help define what we need to do as employers.
And then maybe one final question. We'll bring Dr. Raymond back in and go to some of our viewers' questions. How do you react to the Safer at Home plan, and now more recently the Badger Bounce Back plan? How do you look at that from your perspective as a small mid-sized business operator?
I think the first reaction I had was, why wasn't more flexibility brought into the decision, whether it on a regional, local basis, and it just seems one size fits all wouldn't have been the right answer, and I understand why we did it. I also recognize that when I say I'm for the economy, I'm saying I'm not for health. That sounds ludicrous, because I understand people have lost loved ones in this one, and I don't want to come across crass, but at some point, is the cure going to be worse than the disease? And if the economy can't come back, are we going to have far more people that have no income to take care of their families, whether that be food, shelter, future education, or any of that? And I think so. This is great. I'm backing up the MMAC's idea on this restart. We need to start moving forward now, as soon as we've got the slightest bit of clear, and go forward.
Thank you. Dr. Raymond, you can join us. Chris, questions?
Yeah, Dr. Raymond, question for you. Apparently the FDA has approved an in-home self-testing kit by a company called LabCorp. Are you familiar with this product, and would it be a big step forward to have an in-home self-testing kit?
I'm not familiar with the product, but I did hear that LabCorp was working on a home testing kit, and they're a very reputable company and they have very high standards. So I would expect it to be a good product. Really, the utility of that test depends on what you're going to do with it. It would be best if the information would be available in a public database, so we could not just know what's going on with the individual, but we could give them good guidance and aggregate all that data so that we could have better informed public policy.
Dr. Raymond, another question for you. Going back to something we actually talked about this morning's webinar, if blood donors aren't being tested for COVID-19 before they give, does that put a potential recipient at a higher risk? And I believe there may be a misconception about blood transmission versus other ways that things are transmitted?
Well, I'm not an expert on blood donation other than the fact that I'm a donor and I gave recently at Versity. I think to answer that question, we probably need to bring Chris Miskell or one of the experts from the Versity Blood Center on, and that might be a good idea in the future. But I can tell you that they did very responsible screening questions and checked my temperature and exercise appropriate social distancing. Until we have a validated blood test that can be done right at the bedside, it's going to be hard to do that level of screening.
We've gotten a fair amount of questions about the outbreaks we've seen in meat packing plants. Is there anything particular about that industry, or is it just the idea of a setting where people work in close proximity?
I think for the most part, it's about close proximity. Also, I think that some of the ethnic groups that are disadvantaged and are disproportionately suffering from COVID-19, maybe some of the workers in the factories, and that may be part of what we're dealing with here. And we still don't really know what the root cause of the disparate impact of COVID-19 on some under-resourced minority communities would be. So there may be an element of that as well.
Keith, we had a couple of people write in and agree with you that the health and economy concerns are not mutually exclusive. How do you kind of balance those in your mind?
You know, that is always a hard decision when you look at it, but I think we balance these type of things every day in business. You're always looking at whether it be salary, wages, benefits, how you pull all these together. It's always a compromise. It would be great if there was always one single choice that rose to the top, but there always seems to be conflicting. I raise salaries too high, I don't make enough profit, I don't survive. If I don't have good enough health care benefits, then I lose employees. But if I have too many, I have other problems because I can't raise pricing. So we're always, as business leaders, addressing this situation. And so I think this one, we got to look at it and say, can we do this the right way as a collective group to make it happen and still be safe?
Dr. Raymond, we had a couple of questions about the state's goal of 85,000 tests a week. Do you have any sense of how they arrived at that metric and why that might be important?
I don't have any insight into how they arrived at the metric, but it's a whole lot more than we can do right now. And what I can say is that's enough for us to do focused testing on sectors of the economy that we want to reopen, to be able to go into communities that are hot zones and do real-time testing. And my hope is that in addition to the testing of viruses that they're able to do with those 85,000 tests a week, that we can bring some of those antibody tests to the forefront, because being able to test for the virus and antibodies in the same people at the same time is going to give us fantastic information that'll help us make better decisions about how to achieve that balance between lives and livelihood.
Great, thank you. And thank you to everybody who asked a question today.
Yes, Dr. Raymond, again, thank you for the update. We look forward to hearing from you again tomorrow, and hopefully keep marching down that trend line in the right direction. And Keith, thank you very much for the perspective that you offered. I thought I noted that you wanted to give a shout out or a message to our elected officials before we close.
Sure. As you know, we always end the Council of Small Businesses with a quotation. And so mine today is, a leader is one who knows the way, goes the way, and shows the way. And so to our politicians, let our business leaders have the opportunity to lead our businesses in the correct way to jumpstart this economy.
That's a good message to end on. Stay safe, everyone. We'll see you tomorrow.
Thank you.
Thanks, Tim. Thanks, Keith.
You're welcome.